Hi, welcome to Fast Facts with Dr. Tan. So today we're going to talk about gonorrhea infection. Most of us may have heard of this before. We all know what gonorrhea is. It's a sexually transmitted disease. Most people, when they get it, they'll get a discharge from the genitals, from the penis in men, from the vagina in women, and pain passing urine. We're familiar with this. But of course, gonorrhea can infect other parts of the body and cause different kinds of symptoms. For example, it can infect the eye, causing red eyes. It can infect the throat, causing sore throat. Right? And rather rarely, but yet not that uncommon, it can infect the joints. And this brings us to our paper. There's a review article entitled Gonococcal Arthritis. So it's when the gonorrhea bacteria actually infects the joints. Now let me tell you about a story of a patient I saw many years ago. 32-year-old man, active, fit, muscular. In fact, he was in the armed forces, not the Singapore armed forces, but he's a regular in the army. So a very fit guy. And one day he just developed severe pain in his left knee. Ended up in hospital because it was that painful, and it took several days and a lot of tests later before we actually realized that it was a gonorrhea infection. Now, the thing is, when we ask the patient for the sexual history, obviously he wouldn't naturally link it to his knee pain, right? So the fact is he did visit a commercial sex worker a few days before, but who would think that that would be causing a severe left knee pain? So it's quite forgivable that patients and doctors missed out this part of the history. But then it was detected to be gonorrhea after a lot of tests, and then we managed to treat him successfully. So I think that the lesson to be taken away from this paper really is gonorrhea is a very site-specific infection. In other words, it infects the penis, it causes a certain set of symptoms, it's a throat, it's another set of symptoms, it's a joint, it's yet another set of symptoms. Right? So when you see a doctor, please do be open with your sexual history as well as all the symptoms you have, and then the doctor, I'm sure, can advise you properly on the kind of tests you need to do to clear gonorrhea from the various areas that you could be affected. So this is Dr. Tan signing off.